India has reported more than 49,000 fresh cases of coronavirus, with 740 new deaths, marking the biggest daily surge in infections. The spike comes after a new study from India's National Centre for Disease Control showed that more than 1 in 5 people in the capital, Delhi, have been infected.
India, which has the second largest population of 1.3 billion people, has seen a series of record spikes recently, adding tens of thousands of cases daily. The country has recorded 30,601 deaths from the disease, with more than 40% of these deaths coming from Maharashtra state.
It's very alarming. The very fact that we have not seen such a huge number so far. That means we are constantly, numbers of COVID patients, positive patients are increasing. That's going to put pressure on everything in the system. On economy, it'll put pressure on the hospital, it'll put pressure on the bed, it'll put pressure on every possible resources.
Data behind its case numbers shows Maharashtra as the worst affected state, having recorded a surge of 350,000 cases, prompting authorities to announce stringent lockdowns in high-risk areas. In a country where public health system is one of the world's most poorly funded, some locals are losing hope.
No one can help it. Right now, government is taking its own steps, but it's not helping everyone. Now, you can see in everyday news, there is no ambulance, there is no beds, there is no proper treatment, there is no medicine facilities provided by government, but they are trying their level best.
Experts warn the true scale of infection rates will rise in coming months as testing increases. Meanwhile, a team of scientists from India and Israel are racing to develop a rapid testing kit that could give results under 30 seconds. The country has overtaken Russia in the number of cases and is currently behind the US and Brazil.
Professor Rajib Dasgupta is a community health practitioner who's been observing developments in India, and he joins us now via Skype from New Delhi. Thanks so much indeed for joining us. Welcome to the program. These recent record high spikes in the COVID infections, daily spikes, must be a real concern for the authorities in India now.
It's indeed. What's also discernible now is a shift from the very large cities or the metropolitan areas such as Mumbai or New Delhi, including some of the big cities in Mumbai, in Maharashtra, not just Mumbai, as your report outlined, increasingly to the tier 2 and tier 3 cities, increasingly to districts with relatively more rural populations, and these are also the areas with far weaker health service infrastructure than these large cities. It's not just rural areas, but the smaller municipal bodies in the tier 2, tier 3 towns and cities are also far less well endowed than these very large municipal administrations in the metropolitan areas. These are the shifts in terms of the geography and therefore the emerging concerns in states which were not so far that affected as the ones you outlined.
Do the authorities have any idea why the spike? Did India go full throttle with its lockdown, or was it partial and that perhaps there was an easing too soon?
India's lockdown has been one of the earliest in the region. It's also been one of the most stringent. In the stringency index, it remained at 100 which is a maximum index. This is an index published by the Lavatnik School of Governance in Oxford. So it remained at 100, which is the highest level, of course, from the third week of March to the first week of May. And that lockdown indeed resulted in a slowing down of the reproduction rate quite substantially. However, as we have moved into subsequent unlock phases, it's really the last 4 weeks which has seen the increase quite literally in leaps and bounds. However, there wasn't much alternative of prolonging this very stringent lockdown because of the economic and humanitarian compulsions. The return of very large populations of migrants from urban to rural areas has also been captured in very vivid imagery all across the country and broadcast to the world. And some of the newer areas have a very strong association with the districts where the migrants return from these urban hotspots.
So this movement, is that what may have contributed to Tier 2, Tier 3 cities starting to show increases in COVID-19 cases?
Yes, that's one facet. The other facet, of course, has been the large cities, in specific the slum populations and the older congested parts of the cities where population density and sanitation standards are not up to the mark. And it's understood that much of the disease transmission has happened in those parts.
What can the authorities do to manage these poorer parts of the urban areas? Because, as you say, they're so densely populated, social distancing almost is not possible.
No, there are success stories too. It's not that it's all a picture of gloom. Even from Mumbai, some of its toughest from the public health point of view, slum areas have indeed been well managed. Sticking to the very basics of track, test, treat. However, what's really of concern is for the major parts of the country, or if you look at the aggregate, India's tests per million still remain a concern. So just to give a contrast with South Africa, South African tests per million is 4 times that of India. To contrast with USA, the USA is about 14 to 15 times higher than India in the rate of tests per million.
Why is the testing so low? Is it resources?
It's a little inexplicable. Why is the testing not really so low in absolute terms, so to speak, but why it hasn't picked up to the extent that it ought to have picked up? And that's where, quite likely and quite possibly, some of the fundamental weaknesses of the public health system is probably showing up, particularly weaknesses in the urban health infrastructure. But then that doesn't explain adequately the situation in Maharashtra, as you showed. Again, these are urban areas, but a state with relatively well-entrenched public health systems, including urban health systems. That's equally true of Gujarat. It's also the case that preventive measures or preventive behaviors have been found wanting. Risk communication has been a weak area, and these are aspects that certainly need strengthening a lot more than at present.
All right, let's talk a little bit about behavior, because in the end, actually, that's probably going to be the one thing that we need to change the most right across the world in terms of trying to manage this pandemic. Have people in India started to turn the corner in terms of saying, we really have to do the right thing now?
I guess it's a mixed picture. Unfortunately, that's one parameter on which data is simply not collected and monitored, the preventive practices. There are also very real practical limitations of access to water, access to soap, with very large proportions of underprivileged populations. The mask campaign or the mask practices are still extremely uneven. even among relatively well-educated sections of the population. So it's really risk communication, as the jargon goes, that really needs to be strengthened, and that needs to translate into actual practice.
All right, so 1.25 million people that have tested positive. Are the hospitals still able to cope at this stage? You've mentioned that you were concerned particularly for the smaller cities, but the bigger metros, are they coping?
The fact is that most metros have been coping well. And secondly, the overall mortality rate in India has been, thankfully, much lower than many of the other countries with comparable quantum of cases. That's actually part of the good news. Some very significant increase or stepping up of capacities have also happened, though there are media reports of shortages of protective equipments. But as far as hospital capacity is concerned, India has generally coped well. However, it's a country with a very large private sector, with significant proportions of population dependent on the private sector. There has been very many different models in how the different states have leveraged on the regulatory mechanisms to negotiate with the with the private sector for provisioning of services. So there are, again, bright spots there, and there are certainly some bit of discontentment there too.
All right, and in terms of trajectory, what's being predicted? I know that this is a bit of a moving target, but are we still seeing India going towards a peak? India
as an entity is probably not the right way of looking at it, in the sense that in such a large country, in such large populations, what typically happens is what in our jargon we call multiple epidemics. So Delhi, for example, has actually seen quite a perceptible decline in the last 2 weeks. Optimism is pretty high. Kerala, as a state which gained very early control, is now witnessing some increase in cases as interstate movements have picked up, but yet it's not alarming. There are a couple of other states where it seems to be stabilizing. Some of the remarkable declines, as I said, came in Delhi in the last 2 weeks when things seemed rather bleak. However, there are a cluster of states where it's still very sharply on the rise, and those are the ones to look out for.
All right, so Professor Dasgupta, we're going to have to leave it there, but thank you very, very much indeed for such a comprehensive update for us on the situation in your country. Thanks so much indeed for your time.
Thank you. Pleasure talking to you.